If you are a patient at Smile House and we diagnose that you have any kind of sleep disorder breathing, mouth breathing, snoring, sleep apnea, TMJ, grinding of your teeth, our oral appliance therapy can help you and increase your dental longevity. How can mouth breathing decrease dental longevity? Well, when you breathe through your mouth, there's no filtration system in the mouth like you have in your nose. Your nose is a natural filtration system. If you mouth breathe, you breathe in any bacteria, any viruses, any pollution particles in the air, and this can lead to increased cavities. This can also dry out your mouth. The air taken in through your mouth is very dry air, unlike the air taken in through the nose, which is moistened air and humidified air. When you have dry mouth and dry air coming into the mouth all night long, it increases your chance for cavities, increases inflammation in the gums, and decreases your dental longevity. Bruxism greatly decreases dental longevity because bruxism is a consistent occurrence of teeth grinding, which needs to be stopped immediately. There are some interim and short-term ways to stop the bruxing or stop the damage. You can have things like an occlusal guard, which is a night guard that you put on top of your teeth at night so that when you do grind your teeth, you're not grinding hard tooth to hard tooth. But a long-term solution to stopping bruxism is looking at your airway. If one of the specialists here at Smile House sees that you have a narrow airway or that you have a low tongue posture that may be encroaching into your airway, meaning your tongue at night may be falling back into your airway, instead of putting an occlusal guard on the teeth to make the teeth not rub against each other, we use a more sophisticated sleep appliance. One of them is called the Myosa, where when you wear it at night, it'll take your tongue and elevate it to the roof of your mouth. It will bring your jaw forward so that you can calmly and naturally sleep at night.